Hello and welcome back. Happy Valentine's Day and happy Mardi Gras. This is the February edition of Sisterhood in Surgery. Our topic today is Latina vascular surgeons gaining global recognition. My co-host Palma Shaw is of course here with me, and we have three wonderful guests today from all over the world. Seattle, Washington, Colombia, and Mexico. Welcome. Remember, this is a live show, so you can join by the web. Go to polev.com, enter DeBakey, and respond to activity, or join by text by texting DeBakey to 37607 and text in your question, and we'll get those answered for you live. I'll let Palma start with the introductions today.
Thank you so much, Linda, and welcome to the show, ladies. I'm so excited to have you here. And we really appreciate your time and sharing your experiences with us. I'd like to introduce Dr. Rebecca Reyes-Lugo. She graduated from medical school from the Autonomous University of St. Louis Potosi, then pursued specialty of angiology and vascular surgery at the IMSS Hospital de Especialidades del Centro Médico de Occidente Guadalajara, Jalisco, and the University of Guadalajara. She's a separate diplomist for vascular duplex, endovascular procedures, and comprehensive angiology from the Mayab University. She's certified by the Mexican Board of Angiology in vascular and endovascular surgery, and is a vascular surgeon on staff at the Hospital Beneficia Española San Luis Potosí and Lomas de San Luis International Hospital. She is a member of many societies, I'll mention a few, including the Mexican Society of Angiology, the Vascular and Endovascular Surgery, the SBS Mexican Chapter and DI Committee, the ISCVS, the Mexican chapter, the Frank J. Vieth International, and is an international ambassador of the American Venous Forum. Her leadership roles include serving as president of the Mexican Youth Chapter of the International Union of Angiology from October 2018 through 21, president of Jalisco College of Angiology and Vascular Surgery from 2015 to 2018, and president of the Potosine Society of Angiology and Vascular Surgery from 2017 through 2019. She was the first doctor in her family, same with me, interestingly, and she finished her degree and trained in surgery and then vascular surgery. And at that time, there was no real place for her to study endovascular technique in Mexico. So she worked with a friend of hers who's an interventional radiologist, Dr. Raul Martinez, and she has worked with him for over 20 years. In her practice, she does a broad range of cases, open and endo, arterial and venous, but her passion is a diabetic foot, also like me. She is divorced and lives with Gerardo, her boyfriend, for more than 13 years. She's tried to be a mother 3 times, but had an abortion and ectopic pregnancy and had an in vitro procedure, which she lost, at which time she had a PE. She's Catholic and a faithful believer that God gives you a pattern in your life. So not being able to have children, she's decided to try to succeed and be better in other areas, such as her career. And I admire that. She loves to travel. She's the first Mexican vascular surgeon invited as faculty at the V Symposium and at Charing Cross. And one of her main goals is to help other female vascular surgeons get up onto the podium and give talks, losing that fear of speaking in English, which may not be their native language, and make the work that they do in Latin America known to other parts of the world, and even more so the work of women from her country. Welcome, Rebecca.
Welcome. Our next guest is Dr. Alina Quiroga, who is a board-certified surgeon at the University of Washington Arborview Medical Center in Seattle, Washington. She is also a UW Associate Professor of Surgery and the Program Director for Vascular Surgery Residency and Fellowship Training Programs. She's the chair of the UW Department of Surgery Diversity Council, and she earned her MD degree from Universidad de Buenos Aires in Argentina and completed her residency and fellowship at the University of Washington. She's board certified in vascular surgery and is a fellow of the American College. She believes in creating active partnerships with her patients to achieve the best possible outcomes. Her scope of care include management of peripheral vascular disease, aortic aneurysms, vascular trauma, and dialysis access. Her research interests include outcomes of vascular trauma and ruptured aneurysms, innovations in dialysis access and healthcare inequities with a special focus in Latin populations. Welcome.
And I'd like to introduce Dr. Ana Botero. She is a vascular surgeon and angiologist at the Hospital San Vicente Fundación Rio Negro. I'm challenging my Spanish here, in Colombia.
Thank God you're doing those too. I would butcher both of those biographies.
I'll try. So she's been in practice for 6 years, and she's in the process of becoming an associate professor of cardiovascular surgery at the CS University in Medellin. She earned her medical degree from Universidad de Antioquia in Medellin, where she also did general surgery residency and vascular surgery fellowship. She's an active international member of the Society for Vascular Surgery, the American Venous Forum, and vice president for the Colombian Association for Vascular Surgery. On a personal note, she's been married for 11 years, has no children, and one of the reasons she made that decision is as she carries a mutation of Huntington's disease, which is a devastating diagnosis that changed her life when she was very young. It also gave her many reasons to work hard and make plans in life and commit to them. This incited her to think about maternity and surgery and how to make it happen. And for her, this topic is important, and what she wants to address this and make it more, and in doing so, make this more appealing for medical students and general surgeons who want to have children in their career. Our condolences go out to her as she lost her mother 2 weeks ago to this disease, and we're very sorry for that. She is a multitasker, and in her daily practice, it revolves around the vascular diagnosis, aortic open endovascular surgery, which is her absolute passion. And we're so happy she's here, despite the fact that she was up all night saving a life with a complicated type B aortic dissection. So you go, girl. You are endless, boundless energy. So keep it going. She does also venous procedures, peripheral vascular interventions, academic lectures, and recently the organization of the Colombian Vascular Surgery Angiology Congress, which we are sending numerous SVS delegates. Her passion is to improve teamwork and international collaboration among female vascular surgeons around the world. And I just want to say, you three women are incredible and amazing, and you just really stand out, and that's why we're so glad you're here. And your countries are lucky to have you. And Alina has a special relationship with Argentina. She's sort of there, she trained there, and then she's always back there. So I think of her almost as an Argentine. So she's going to give us some insight about being from Argentina, training there, and then how she became so successful here. So we've got 2 views for that. So thank you so much. Do you want to start, Linda?
We wanted to focus on the day-to-day challenges of Latina vascular surgeons, and just from going through your bio, there have been many challenges that all 3 of you have faced, and with obviously grace and poise. So we just wanted to pick your brain, get your thoughts on where you got to where you are today, and who were your role models when you first started your journey in your career. Rebecca, do you want to start? Rebecca, can you hear me? Hello?
I lost you.
I think, can y'all hear me?
Yeah,
I hear you.
Okay.
Right now, yes.
Okay, go ahead.
I was going to say, Rebecca, do you want to start on, did y'all hear the question?
No, I didn't hear it.
Oh, okay. I was going to, the question was, who were your role models in starting your career in the beginning? Who did you look up to?
Look, since I was a child, I don't know why, but I like it, medicine school. When I was on the high school, I have a teacher, a biology teacher, that I love her. So I really wanted to be a teacher, but at so many years ago, there were not where I live, there were not that career. So my dad told me that I was 16. So he told me that I was going to the university and I have to choose something that were here in San Luis Potosí, where I live. So almost all my friends were to the medicine school. So I said, yes, but I can try there, and I love medicine school. I have a lot of troubles the first 3 years because I was very young to be mature enough to study medicine. So I was a little quit 1 year, and the next year I said, no, I have to try it. And I guess I have such a good professors, and I have some mentors, but not at the beginning of my career until I finish and I choose a vascular surgery. I really have good mentors. My first mentor is my father, that he always believed in me. My mom too, but I guess my father is, is the man of the house, and he told me that I can do whatever I wanted. So he always believes in me. He always support me, and my mom too. But moms are always with you. But sometimes when my mom, she doesn't have a career, my dad does, but. My father always asked me about I have to finish a career and I have to get specialized, because he didn't want me to be just general medicine. So I decided to choose vascular surgery because I saw my first bypass and I got, in love with that. When you see that artery is pumping blood again, and I don't know, it's just like a feeling that you fall in love with vascular surgery. So when I was in Guadalajara studying vascular surgery, I always told him, my boss, Dr. Francisco Llamas, he was very good with me. It was like a family for us. And he always believes in me too. So he always pushed me, and he said that I was a very good vascular surgeon and that I can do a little bit more, because I got divorced on the last year of my residency. So it was difficult for me, and he always talked to me and tell me that I can do a little bit more. I can be better each time. Doesn't matter what happens with my personal life, because this was work. This was my career, and I was going to live with this all my life. So I guess that two people are very important for me. And outside this, when I started to my career, I guess my other companions are really good with me. I have a very close friends and vascular surgeons here in Mexico. One of them is Nora Sanchez Nicolat, that she's very good. We are close because we finish at the same time, so we are of the same age. And we started to open us our, your field, and sometimes it's difficult to be women and to be the first one doing something. So we are together in many things. So we start traveling. For example, our first time outside Mexico, we give a talk in Dubai. It was the first time that we were together talking in English outside Mexico. So it was very important to have a friend, a vascular surgeon friend, that she's always with you. Nowadays, we're very close. So I guess that it's important for a woman who is starting in this. And besides that, I guess everything is nowadays are relationships. So if you have good relationships, if you have friends, these relationships sometimes starts with something about work, but later it becomes friends. So I believe that is very important, because sometimes I got invitations to give a talk for a friend, for example. So it's important to have relationships. It's important to make new friends, knowing new persons, and never be afraid of, and never feel that you're less than somebody else. So I guess this is, for me, it has been very important, and it opened me so many doors for me. So that's why I'm here. Thanks, God. Thanks for the invitation, by the way.
Alina, what about you?
My story is a little more complicated. I was reflecting when Rebecca was talking. So I was sure that I always knew that I wanted to be a surgeon, not a doctor, a surgeon. And I was going to do minimally invasive surgery. And Dr. Pellegrini, he was the chair at the moment, and Dr. Schlager, they were all my mentors. And my first day as an R4, I got exposed to vascular surgery. I was a carotid with Dr. Sobel, and I fell in love with vascular. And after that, I went to do a case with Ben Starnes, that he's my boss now, and he was doing this crazy PMEX. I was talking about 2007, like a long time ago. And it's like, oh my God, this is science fiction. I want to be this, but I was going to do laparoscopic surgery. So talking about mentors and people that have support you, I changed my career. Like after the application for the fellowship were almost open, and they support me in the change of heart. And when I did vascular, here we are. So those like Starnes, Pellegrini, Schlager, they're my first mentor. But I didn't have that many women's mentors. Role models, of course, I have seen talking and hear about Julie Freshlak, and I don't know of any vascular surgeon that trained any woman almost in the world that have not had Julie as an inspiration. But when I was just thinking about this, I remember going for interviews for fellowship at the Mayo Clinic. Dr. Duncan was there, and she interviewed me. And I don't know, I never told her this, but she was this amazing surgeon. She was a woman that was doing crazy, like big aortic cases. She had her office full of all these pictures of her kids. And I was like, wow, I just want to be like her. And so that would be like one of the role models. Even though I didn't have that much relationship with her at that moment, I was very impressed by her career. And after that, a lot of people. But that maybe I find these three moments like a very important in the very early role models for me.
And she's very down to earth, very easy to talk to.
Yeah, that was why I was very impressed, because I was so afraid of interviewing with her. And 5 minutes later, I felt like, oh my God, I want to be part of this group, like of this sisterhood.
And Anna, what about you?
Well, my story with medicine started when I was very young. At 4 years old, I said that I wanted to become a doctor because I was someone with special needs. And in every meeting at my house, everyone was laughing about it. So they still mock me because of that. And surgery came a little bit late. I was doing my internship year, and I went into my hospital. The one that I got medicine from is a very huge trauma hospital. And when I saw my first heart wound and aortic wound, I said, I want to become a surgeon. Like I saw people repair something that for me was done. And I had two female surgeons that were perfect trauma surgeons. And you said this guy's going to die. And then 2 hours later, he was asking for food. And I said to myself, I got to become one of these. And both of them are retired by now. Dr. Flores is one of my mentors. And I also have men as mentors. I also had male surgeons that I think they're listening today for this. But in Colombia, trauma is a very huge part of what we do. And vascular is major on trauma. And I started to find out that I loved vascular. And vascular surgery was an accident for me because I wanted to become a cardiovascular surgeon. And this is the fun story. They didn't take me because I was a woman. And on the interview, they asked me about if I wanted to become a mother, and that if it came between me and my career. And some guy got in and I got out, and I went to have a breakfast in the morning just after the interview. And my vascular surgery teachers were having their breakfast too. And they said, okay, Anna, you're good on this. Why don't you get into vascular? And I said, I don't know. I'm so sad. I couldn't get in. And story short, they were my mentors through my whole career. And I'm very happy that I made that choice. We have so many things to do, and I'm so grateful to have them in my life.
And
STS, really inspiring.
And STS is probably very sad that they did that, because Their numbers of like full cardiac female surgeons is, I think, 2% or something like that, like that are not thoracic. So diversity is one of their big pushes. You can't tell from the STS president's talk, but it is, McGilvery was here before, and it has been one of their main pushes. But I digress. Palma, you want to go to the next question?
I know we wanted to see, really in your country, what's happening. I know we're trying to bring more women into vascular surgery. So how's that going in Mexico, Rebecca? Do you feel like the numbers are increasing with the younger trainees?
Yeah. Definitely. When I was the fourth vascular surgeon in my center when I was. And before me, I have a very good resident fellow that she teach me a lot. But after me, there were no women. The next 1 or 2 years more, only men. And now, surprisingly, there are some of the new generations that there are more women than men. So we are increasing in many parts of Mexico. Yes. So it's great. I mean, it changed since medicine, since the faculty. There are more women than men right now. So there are more women in surgery, and I guess this is changing the way of thinking about that a woman can be a surgeon. So it's very good.
That's great.
I'm so happy for it.
Rebecca, do you think, how do you describe your relationship with your patients? Because I know, like you were talking about your traditional family, your dad was the breadwinner, right? Your mom stayed at home. Do you find that the more, like the older generation have an issue with female surgeons, like you're not what they expect, or do you think that's changed?
This changed a lot because, for example, in our specialties, we see a lot of venous. I mean, I live and I eat because of venous diseases. That's my reality. Mm-hmm. So a lot of women go to a women vascular surgeon, most of them because they're ashamed of, show their legs to a man. So it's good to be a woman in this specialty. Mm-hmm. I don't know where else in United States, but here in Mexico, it's better to be a woman because some women are more comfortable
going to you. Yes. Mm-hmm. I actually have a few, when you say that, I have a few international patients from Mexico that come to me for their venous disease. And I think they seek a female, like, in particular.
Yes. Yeah. And men too. Let me tell you, because some of the men that come to you is because the wife goes with the men. Sometimes it's that. I mean, I have the women is going with you to your office, mm-hmm. and then she took the husband with you.
Yeah.
I said, okay, she's very good. Mm-hmm. And I said, okay, thank you.
Yep.
So Alina, you're a program director. Can you just mention the trends of female applicants and what we're seeing here in the U.S.?
Yes, as most probably people know, the recently released data, the number of women going into vascular surgery is really increasing. We did a study at my institution a few years ago, and doing what we call an integrated vascular surgery residency program, and for CT surgery and for other specialties, also helps increasing the numbers. Right now, we're 36% of our trainees are women. If we're going to look at the Latinas, that number goes really, really down. Remember, there are only 6% of the physicians in the US are Latinos, when around 19 to 20% of the population is Latina. But 36% of last year actually, the year that's finishing, residency programs in integrated vascular surgery are women, and that's amazing. but we need to keep this movement upward. No, we need to work in reflecting these changes and bringing all this group down to the leadership, now up to the leadership. So we have not 36% that stays, like in other specialties, like pediatrics and OB, that they have a lot of women, but yet the leadership is very male-dominated still.
So the 6% of Latin physicians, is that equal women and men, or like?
No, the women are less, actually. They're more male than women. That's my understanding. And in vascular surgery, we have the last survey, I think, that put the Latino surgeons in 3%, the Latino vascular surgeons in 3%, and the women are, we know each other. That's all I can say.
Wow.
We know exactly who we are.
So the vascular surgery specialty is then behind other specialties, because if it's average 6% and we're only 3%, then that's, yeah.
Yeah. Yeah. So I think that it's getting better. We don't have data for this from the Chinese perspective, and I hope that's getting better, but still is a minority, and especially doesn't really reflect our population.
Right. And Anna, I have a question for you that's live from the audience. Hello, I am a 10th semester student in Columbia. What is the most difficult thing you face being not only a woman, but studying as a female surgeon?
Hard question. I don't know. You're just getting promoted to doing things just because there's so many people that you need to have something special. So everyone has something special. You need just to find what's your specialty and to, get it better and better every day on it. So I took advantage of what I had. I'm not somebody pretty smart or pretty special or pretty great women. I'm just like you guys and like everyone. I just saw myself and I said, I'm good at this, so I'm going to exploit it. And that's something that I want you guys to know. I love what I do. Every day I go into the OR, I enjoy it. Like, I get there and I put on my music and I laugh with everybody. I say hi to the patients, and I tell them that they're like my family. So they always ask me, do you have any children? And I say, no, you guys are my children. So I don't need to have any. And I take that with me. I don't do this because of the money. Everyone has to pay the bills, but I really, really, really enjoyed it.
That's great advice. We have another question from the audience. As the next generation, as med students, what motivates you to be a vascular surgeon? How can the next med students become leading female vascular surgeons?
I love my specialty, and we have many things to do. If you do general surgery, you're going to be. I don't like operating the abdomen, so I said I'm out of this. If it's gonna leak, do it immediately. I don't want to wait for it to leak. So I said I'm going into vascular. But I think that you need to take the time and dedicate for the things that you want to do, and take the time and study and enjoy doing it, and practice and practice and practice. I remember when I was a medical student and I went into surgery and I saw like all the rituals that a surgeon has in his everyday life, that now I see this as a very normal thing, but then it was so special to me. It was like magical. And I think there's magic in what we do, and vascular surgery has a lot of magic. Coming from a school that it's almost everything was open, and then going into changing your mind and getting into a cath lab and thinking in 2D and not knowing what to do with a sonogram in your hand, and now using every tool. I feel like a boy with their toys. Like, I'm a girl with a lot of toys and I use them every day. So it's a very fun specialty.
I definitely agree on that. Palma, do you want to ask the next question?
So, as Alina alluded to this, I mean, the glass ceiling, I think we are getting better. It's still there, but I see women moving up. I see more of us moving up, and I feel that there is a lot more support from the men. I could name 10 men off the top of my head who I could say have mentored me and helped me and are there for me. And one's watching right now, Rod White, our very committed, always watching the show supporter. He's always there for me, for example. Do you find that there's a surge or an improvement or a chance of breaking that glass ceiling in each of your arenas? Alina, what do you think? Do you feel the same as I do in the States, or?
Yeah, absolutely. I mean, there are challenges as always, but things have changed so much. And I think that one of the things that's helping this is the accountability that is requested to the leadership now. Now is even the younger generation is asking for this. Social media playing a huge factor in visualizing problems. Yeah, there are still problems. I mean, we all know about the lawsuit that one of our colleagues had to bring due to sexual discrimination or gender discrimination recently in one of the universities. So there are still problems, but things in the big picture, I always said when I'm in the operating room or we're talking with anesthesia, I want to bring a patient, like, you have to be an optimist to be a vascular surgeon. You cannot be doing what we do if you don't think that things are going to be well. And that's kind of the same way that I see this. I think I have optimism because I see accountability. I mean, I see this request, this demand for accountability from the leadership. And I hope that things continue to improve. But I agree with you, Palma. Things are looking better. And I can count. I mean, I don't have enough fingers to count how many people up I know that they're helping and they're actually looking how to help. That's a good point as well.
Future is bright in vascular surgery. Rebecca, how do you feel about Mexico from your perspective?
Look, here in Mexico, there is two things that happens to women. One is the glass, the ceiling glass, and the other one is the feeling like an imposter, that you are fake, like when you are not enough secure of yourself and you feel like you gained something, but you don't believe in yourself and think that other people are going to see you like you are an imposter and you are and you don't know everything and you are like a fake vascular surgeon. So I guess this is important for us, for women, to stay each other women close to another women who support you. But it is very, very important to have a man. I guess our lives without a man who support us and to make us feel secure about what are we doing, it's very important for us too. So we can call mentor, we can call friend, we can call colleague, or maybe it can be your partner, it can be your boyfriend, it can be somebody of your family. But sometimes women are very insecure about some work things. So I guess we have to fight against this. And my way of fighting is feeling more secure and to have a friend and who can talk with and who can be with you. Even my boyfriend, he is very supportive with me. He always stands with me in everything. And besides that, my other friend who helps me always is, you know him, Dr. Frank Beat. He's always with you. He always answers you an email if you have any doubt. And he's a great man, but he's very easy to talk with him. And you can send him an email. Maybe he can, you can answer very quickly, but he's going to answer you. And that makes me feel very secure about what I am doing and where it's my next step. So I guess this is very important here in Mexico to have a friend. Outside Mexico, you can have friends who can support you, who can match with you I guess this is very important to fight against your fears.
I think that's why we're here supporting each other on the show, right? Because when I wanted to bring us all together, I felt it, the three of you really have that special quality that not only do you want to connect with other women in a global way, but you're also really leaders in your respective countries, and you want to help pull other women up. And that's a very special quality you have. And I echo your sentiments about Dr. Veith. Nobody's ever been there for me the way Frank has. In the drop of a hat, he'll always support me and has always been there for me. Anna, do you want to comment a little bit about the imposter syndrome and how maybe in Colombia you would advise some junior trainees or junior faculty to deal with that?
I've lived it myself, you know. I've been a vascular surgeon for 6 years, and when I started my practice, I've been alone for 6 years. So I built my practice from 0 to 100 in a big hospital. So when I got there, I was very, if I look young, I gotta take a picture and show that to you. Patients would walk out of the OR, or they would walk out of my appointments because they said, I need someone with gray hair. And I said, okay, I die and I sleep on cryogenics. That's it. And I take it as a funny thing, you know. And I think for women, we have a superpower. You know, we can do whatever we want. We can pretend to be whatever we want. So when somebody doubted me, I had two mentors. One who's my boss, and he said to me, if you want the opportunity, it's all yours. Take it. But you got to knock it out of the park because everybody's watching. And if you say, I can do this, and then you back down, then you're going to get in trouble. So take it out of the park. But he gave me the window of opportunity. And when he gave it to me, I took it and I tried. And every time I could do something better or something different, I would get into it. And the other one that I wanted to talk about was the one that doesn't leave me behind, like Dr. Veith to you. For me, it's Dr. Jorge Ulloa. And he's been somebody that came into my academic life as a video. I saw a video of him giving a talk, and I said, I like the way he thinks. He was addressing not having enough women in the society that we're in, and that he wanted to change that. And he wanted to give us a little chapter. And I said, okay, at least he's talking about the issues that we have. And I started working as someone for the board. And I was sort of the quiet on the room. And then I started talking and started getting into these meetings with these people that I admired, and I could talk and sit. And 6 years later, I was in a moderator table with Rebecca and Frank Veith by my side. And I freaked out. Like, I took a picture of him. Like, because for us, it's amazing. You know, I've read so many things. I've seen your videos, and I told you I was a fan of this YouTube channel. I've been a fan for years, and if I'm gonna get into a surgery, I would read it, and then I would go to see the videos. And when you invited me, I was jumping in my house at 11 p.m. So I think that we need to enjoy these years where we're growing and make sure that you see women that look like you, see women that you want to become, and then look at them and say, you know, just help me to get where I want to go, that I'll give you whatever you want, because that's the way I do it, you know. I press the accelerator and I do it even if I don't have any time left.
There's another question from the audience. In this profession, I find myself almost compulsively apologizing. What are steps that we can take to be more confident, lose the imposter mentality, and intentional in what we want in the OR, in meetings, etc.?
Sorry, can I answer that one?
Yes. Oh,
I'm joking.
Yeah.
Sorry.
No. Yes. Yes, you can. Yes, you can. I was going to comment myself that when I hear my female residents apologizing, I correct them. I'm like, why are you saying sorry? It's not your fault. Why are you saying? And I just keep doing it and over and over and over again. Anyway, Alina, go ahead. You were saying.
I was joking, but it's so true. And that's unfortunately, as we know, there are different types of leadership and different type of expectation of how a woman should behave in the operating room or academically. And we have this ingrained, like starting every email with, I'm sorry to bother you, or like asking always for permission. And they go very hand in hand with imposter syndrome. And just you have to get it out. You have to, obviously apologize and ask for permission every time that you have, but it's not every single time that you need to start your text message or your email with a sorry but or sorry to, because other people don't do it. And that's, regarding that, and imposter syndrome, what's good is to have a good friend. And we all have those friends that help you. We are this kind of personality that want to be good for our patient, and we get this imposter syndrome all the time on us. And so you need that friend. That I have several that they will support you and they will tell you, okay, you're ready. Like, are you going to apply for this? I'm like, no, they're asking for all these things and I only have 7 of the 10. And that person said, no, you should give it a try. You want it, you should give it a try. And you should be that person for your friends as well. Regarding the apologizing thing, I'm working very hard. I still do it a lot, but it's part of what we have learned, how we have learned to conduct and to basically survive or to do better sometimes in certain circumstances.
I just want to make a comment. Interestingly, when someone that you may just know a little bit, you've met them at some meetings, when they put you on the podium, when they include you, when you're asked by someone you maybe don't know that well, that they ask you to be on the podium for the SBS, one of the programs for the SBS, or you get asked to be on the VEITH, because Frank, what he does is he goes around and looks at everybody who presents at the meeting, and he sees that you do a great job, and then he emails you and he puts you on the podium, and that's what he does. He actually seeks people out at times, and if they do a stellar job, he wants to put them on his podium. So when you get that opportunity from someone that isn't actually your friend, it almost means twice as much, right? Because this person has no real obligation to ask you. They want you because you are great. And I think that means a lot when that happens.
Can I say something? Look, sometimes you get confidence when you're young. I have been vascular surgeon for the last 20 years right now. So when I was like Anna Maria, when I came to my hospital 20 years ago, I looked younger, of course. So everybody was, did she really knows how to do surgery? You look younger and people has these doubts about you. So sometimes when I get confidence very quickly because I have a very challenge case. So everybody was watching me, like if she knows how to get this patient alive, and I did it. It was a challenging case, but it was a good result. I got a good result. So everybody was like, oh yes, she knows what she's doing. So you gain respect from other ones, and you gain your self-confidence. So I guess you have to do it like this. Sometimes you have a very challenging case and you got a good result, and that's all. You are done. But sometimes that challenging case never appears. So everybody's watching you when you are, because you think that they want you to fail sometimes. So you have to be mature enough, and you said, okay, nobody knows everything. I have a phrase that it's always like my mantra, that it's, I don't know everything. I cannot fix anything. everything. But I know the telephone or the cell phone of somebody who can help me. Come on, we are not superwomen, even that we think that we are, but sometimes we need help. So we have to be very confident with ourselves, be very smart, to know where you can do the things and when you cannot do the things alone and you need help. And I guess this is one of my favorite parts of my life, that I have always the cell phone of somebody who can help me when I cannot do it. So sometimes you need new ideas. What else can I do with this patient? I do this, and nothing results. So sometimes you have to be very, how can I say it, trust in yourself, in your feelings, and say, I cannot do it, I need help. And that's valid too. And that makes you feel better with yourself and more secure about what you are doing, and that you get good results, and that's the best thing you can do.
So speaking of Superwoman, Rebecca, can you tell us more about the SWAT, or the Superwoman Angio team?
Yes, this group begins thanks to Julie Freschlag, even if you know it or not. A few years ago, well, not a few, like 7 years ago, that she came here to Mexico to do some talks, at the with Dr. Carlos Hinojosa. He invites her, and he invites almost for all the talks only women. That was very important for us, because we were like at the hotel in the afternoon. We were at the bar drinking some red wine, and Julie talked with us about the SBS, and they were, a cocktail for the women. So she told us why we are not doing a group here in Mexico to support women between women, about vascular surgeons. So we decided to do it, and we started first with the people who we know each other. Right now we are more than 100, like 130, I guess. But now, for example, Alina is in our group, Ana Maria is in our group, because they speak Spanish. We are starting to make it bigger with people, with women vascular surgeons out of Mexico. So sometimes we are a group of support group. That means that if you need a vascular surgeon in Cancun and you are going to send the patient, we prefer to do it between women. So we ask always, who is in, I don't know, Cabo San Lucas? No, there is Dr. Roque. I said, okay, we are going to send you a patient to you. Who is in Mexico City? And you know, Mexico City is like New York, it's bigger. Mm-hmm. So in which part of Mexico City do you need it? I said, okay, I need it in the north, I need it in the south. So there are more vascular surgeons there in Mexico City who can see that patient, and there are women more than men. That is one of the part of the Superwoman NG team that we call SWAT. The other part, is to talk about some cases, because when you finish, you know that you are younger and you don't know everything. So sometimes we ask, I have this patient, and we put the pictures, we put the case, the complete case. She's a woman, she's a man, etc. And we have we give our opinions of what are the possible treatments that we can do, or maybe the studies that we needed. And the third part, the jokes, the pictures, and particularly in me, I use this group of work to send messages about Congress, symposiums, and we like Latinos, sometimes we got some discounts. So I always promote the discounts in some meetings, vascular meetings, to go outside Mexico.
Now, is this on Facebook or WhatsApp, or how would the audience, if they wanted to join?
I didn't hear you.
Oh, I said
it is a WhatsApp.
It's a WhatsApp group.
It's a WhatsApp group. Yeah.
Okay.
It's a very active WhatsApp group.
Okay. So
and of
if
course,
anybody
don't forget the happy birthdays.
Okay,
Yes.
so you have to be invited then.
Yes.
Okay.
And we talk only Spanish. There is no English there, so we are almost all are Latinas.
Okay.
Or speaking Spanish. If you speak Spanish, I can send you.
Just a little, but very little. I have a.
We'll teach you.
I have a comment. Thank you so much for leading the way for this from the audience. Thank you so much for leading the way for us. I am currently a fellow under Dr. Shaw. She lifts me up every day. I hope to meet all of you in the future.
Helpful.
Dina helps me, believe me, helps me a lot. She's a good girl.
That is so sweet.
I wanted Anna to mention about her meeting because Jorge Ulloa gave us all the women's names, and all those women have been put in with the women's section for the SVS that we started. And they're going to hold a women's symposium at the meeting that I'll be participating in. And I'd like her to be able to mention her upcoming meeting, if possible.
I am super excited to invite you all to the Colombian Congress of Vascular Surgery and Angiology. It's going to be from March 8th till the 11th. So it's International Women's Day, and we're going to celebrate it like so. And all of us are going to be there. You guys virtually, Rebecca is going to be with us in person. And I hope that this becomes a trend and that we can take this out of the Colombian Congress and start this to the whole world to make sure that as women, as Latinas, as vascular surgeons, young or whatever age you are, or wherever road in your career you want to go, you can see someone who looks like you and who's very professional, who knows how to speak and who gives excellent talks. And then you want to, I was going to say that I've been in a couple of my days a stalker to most of you, and I admire you and I want to become like you. So it is a pleasure to be here, and I want you guys to be there. It's a whole women session, and we're going to have a blast. And the girls club is awesome. So I love it.
I think we need closing comments. Alina, do you want to make a closing comment?
No, it's just I was reflecting when I was hearing Anna and Rebecca talking. I hope that people in the audience get an idea how amazing all this group of women in Latin America doing now. I mean, they're very humble and they're not saying all the things they're doing, but Ana Maria is one of the few women that is doing ascending aortic and very complex proximal aortic work. And that's yes, I do that.
I'm gonna
completely. And Rebecca, that's amazing.
The imposter syndrome is taken. And also like Rebecca, I mean, she when you learn about mentor, coach, and sponsor, she is the three things in one for so many people, and that's also so important. And just for all the people that are listening that they are not in Latin America, they want to know how they can support this amazing group. So when you go to the BAM, when you go to the BIF and you see the international sessions, please go, listen, ask questions, let them shine. So you ask a good question, they will be able to tell you more about the work. And again, the other people listen and say, yes, you agree, that was a great presentation. I have so many questions after. So just support us in a lot of ways. But that's maybe one of the very simple things to do. Just show up when they're talking, show up to the international sessions. Sometimes they're not in the bigger room, but you will learn so much for this group.
Thanks, Alina, for the pitch for my International Relations Committee sessions, which are running this year. I hope everybody comes to VAM and comes to the international lectures. And Rebecca, a closing comment, because we'll run out of a few minutes.
Yes, I just want to say that you're amazing. We have a lot of good mentors We have and maybe there, the mentorship is a word, a big word, but sometimes I don't feel like a mentorship, but I can feel like a friend that you can come with any of us and ask us something. I mean, for example, I always said when I travel, I pay, to be here, you have to pay a lot of money, for example, because sometimes you are not able to get a grant, or maybe here in Latin America, the sponsorship by some casas comerciales, I forgot the name.
Companies, medical companies.
For medical companies.
Yeah.
We didn't get that. So, besides, we are women. So sometimes they choose more than men than women. So sometimes you have to pay. So in my way, I always said, if I go to this international symposium and everybody wants to go and they don't have enough money, I always share my room. I mean, it's a little thing, but I can help with that. So it's not like a mentorship, but it's like a friendship. That if you want to go outside, you can ask us. We are very easy to find us. So the thing is that I want not only to be 3 of us in this kind of talks. I want to have a lot of women. And the Frank Beats Latin American session, I was so proud that Ana Maria, Alina, Young, and a lot of women go. For example, from Mexico, I got 3 beautiful women that they were there to talk in English. Amen. One from Argentina, she said, okay, I'm going to speak Spanish. And I said, okay, you can speak Spanish, but present your slides in English. That's easy. So we have to encourage the English. We have to start going outside of our comfort zone. So we have to try, if we want to be better in what we do and we want to show what we have done, you have to have enough pants to do it. And we have to be like a sisterhood. I mean, we can be by side to the other side, and we can surround between women to be better. And of course, like I always say, we need men too. For example, Jorge Ulloa from Colombia, he's very women supportive. And I said it, and I'm Mexican, I'm not Colombian. So we planned the Latin American session, like Ana Maria said. We are very close, and besides that, we match in very in the way of thinking. And he did it because he has 2 kids, 2 girls, and he said that he wants a better place for them. So he has to start with us. So I guess that's the way of thinking of a good man.
Palma, will you take me to Colombia with you?
I'm like a travel agent. I've been like putting people in meetings, Dubai, all kinds of places.
No, but like pay for me to go.
Maybe I could find funding for you, But we have to wrap up, and we could do another hour of this, but we're going to cut us off. So we're good.
Well,
you guys are amazing.
So much for all your time.
I can't wait to see you at the VAM, at the VEITH. We're going to see you virtually or at the Columbia meeting.
Yes, welcome.
Thank you so much. Thank you so much for holding
this space. For this space for us. It is amazing.
It was great.
Thank you. Thank you very much.
Good night.
I really appreciate it. It's nice to see you.